I'm Linda Link. I'm doing my current events news video number 2 from Economics 201. We all have a number of questions this time of the year since it's tax season. You wonder if you have to pay or get a refund. Who gets to process your paperwork? Wonder if the person or the organization filling out your forms are even filled out correctly. Wonder if you will be scammed. Top priority will be tax refund fraud. There were over 1,100 fraud investigations in 2016, which decreased from 2012 to 2015. Tax scams will never go away, but they have decreased within the years. The IRS is doing everything possible to prevent fraud cases. There are a few steps you can take to help you from being scammed. Try to file your taxes as soon as possible. This helps lower the chance of your Social Security number being used by someone else. Try to keep your information in other places instead of email accounts. You know how emails are always being hacked. If you get a call stating that they're from the IRS, you should automatically know this is a scam. The IRS does not call you. If you receive calls stating they're with your bank or credit card, don't give them any information. Call the company back on a number you're familiar with and ask questions. If you're asked to sign a blank return form, walk away. Scammers do work within organizations who have gained their trust within the organization. You can stop scammers by opting to get credit monitoring services all year round. If someone uses your Social Security number, you'll be notified immediately. I do feel it's a shame you have people who try to take advantage of others. I, like many others, work hard for what we have, and we do hope at tax season you do at least break even so you don't have to pay on your taxes. But you have others who want something for nothing. They scheme all the time trying to figure out how to scam others. I had a Social Security number stolen a few years back and did not find out until we filed our taxes for that year. Once it's stolen or you're scammed, it takes a developed by the United States Department of Agriculture. Everyone could benefit from this process. Getting individuals off the system, providing healthy meals, and helping the American farmer who grows the product. It seems like a win-win for all. Americans with retirement accounts not only once benefit from stock markets, but the stock market has also enriched investors of another class, with the profits being found as problematic. Nonprofit hospitals are using Wall Street to fatten their bottom line rather than lower what patients pay for the health care. Changed over years, the responsibilities of the hospital CEO. They now focus on the bottom line, and the hospital's performance rate is based on the profit of the hospital. Not all hospitals are profitable. 1/3 have margins that are above zero in general. 1/3 are close to zero, especially when it comes to patient care. And 1/3 of hospitals are running in the red. In small hospitals in rural areas and a number of large college teaching hospitals struggle to break even. Financial records indicate that largest nonprofit hospitals earned approximately $21 billion in investment income last year. This money also almost tripled their 2.7% operating profit for patient care. There's nothing wrong with the hospitals investing, but where does the profit go? Some of the reasons nonprofit hospitals are holding on to the investment profits are due to the lending companies. The lending company needs to see the hospitals have funds on hand before any debt can be expected, buying new equipment, and making other investments. Lenders want to know hospitals have some type of reserve when something goes bad. Even with this, questions are being asked whether patients aren't receiving some of these benefits. As far as patient care goes, the hospital is locked into a system by whom and what is responsible for picking up the cost of the lab. This still doesn't make sense because Medicare and Medicaid patients sometimes mean a loss for the hospital, but all of this is made up from the private sector insurance. There's a lot of market power in the healthcare side. The hospitals are going to be able to negotiate lower payment rates, but this is not being passed on to those savings on the enrollees and the insurance plans. They're pocketing the profit. When healthcare costs more, the health insurance premiums are higher and employees and individuals pay more. I feel the insurance industry has profited too much from individuals. This is why you find so many without health care insurance. If the hospitals are investing and receiving a big profit back from Wall Street, why shouldn't they be willing to pass some of the savings along to others who purchase health care insurance? I know the hospitals want to make a profit, but they do not need to make their profit off of only a few individuals. Individuals who really do need to get medical attention hold out as long as they can because they cannot afford to go to a doctor or the hospital. Maybe if a problem starts early and an individual can't afford, the outcome of the medical condition won't be as bad as it is if they'd have started in the beginning. There are others who have assistance, like Medicaid, who go to the hospital anytime they get ready for any reason. There should be some type of compromise. Medical assistance is something everyone needs at one time or another. Thank you.